Exercising with MS is hard, and maintaining and losing weight with MS is hard too. Am I right? Today, we're going to get expert advice on both of these topics from my friend, Dr. Gretchen Hawley. Dr. Gretchen is a physical therapist and MS certified specialist who teaches science backed exercises that simultaneously rebuild and rewire neural pathways while increasing muscular strength. She's also the creator of the MSing Link, an online program developed specifically for people with MS to improve strength, balance, walking, and more. And she wrote the MSing Link book that goes along with it that I will put a link to in the description below. Welcome, Dr. Gretchen.
Thank you. Thank you so much for having me back.
I'm so excited that you're here again. I have been getting questions from my viewers about exercise and specifically how we can exercise when we're overweight and the challenges that we face there. So let's start with why it's so important to exercise with MS.
Oh my gosh. All of the health benefits of why it's important to exercise anyways, just even without MS, apply. But then you add MS on top of it, and exercise from we know from research can help improve strength, balance, walking, reducing spasticity, reducing specific symptoms like drop foot or scuffing your foot and tripping, and it can improve cognition and possibly most exciting, at least for me, it can actually promote neuroplasticity, which is rewiring and strengthening of the connection between our brain and our muscles. And research is showing that it's going to be likely a big component in remyelination as well. So, exercise is extremely important, and it's all about finding what exercise is possible for you.
Oh, thanks so much. I read a study early on after my diagnosis when I was first starting my YouTube channel that said exercise is the single most effective non pharmacological treatment for MS. So, right after our drugs, exercise is the second most important thing that we can do to help. And for the neuroplasticity piece, for those who don't know, I started my MS journey in 2006 and I had a relapse, but I wasn't diagnosed at that time. And I had pretty profound foot drop. They treated me with steroids in the hospital over the weekend, and I had all kinds of tests, but I wasn't diagnosed. And then I started exercising more. You know, when you have a major health scare, things happen and you go, "Uh-oh, I need to take care of myself." And I started doing yoga, and I was really consistent with it. And I did yoga like 2 or 3 times a week. And over a period of months, my foot drop almost disappeared. And I think it's because of neuroplasticity. I didn't know what it was at the time, but looking back in hindsight, I'm like, oh, yeah, that was probably neuroplasticity.
Yeah, absolutely. And neuroplasticity, for those that don't know, it's the ability of our brain to do two things. It can either strengthen those neural pathways, again, that connection between our brain and our muscles, it can strengthen them, or it can create brand new ones. So in Vickie's case, hers were strengthened. They were already there, they were just weakened due to demyelination. But when you see improvements within, the first few months, that's more likely a situation where your brain and the connection between brain and muscles are getting stronger versus if you're hearing that story and you're thinking that would never happen because when I go to lift my ankle, nothing happens, then what likely would happen for you is the second thing that we mentioned where your brain will try to find a new way, a new pathway from your brain down to your ankle to work. So it can work in both ways. That does take longer. That could take anywhere from 9 months to 2 years with consistency, but both are possible.
Yeah, I think patience is the key. On my channel, I talk about diet and exercise and sleep and mindfulness are all really critical to maintaining my health and well being. And then sometimes I hear people say, oh, diet doesn't work. I tried all those diet. It takes time. And same with exercise, it takes time. Uh, Functional exercise is different from what we typically think of when it comes to exercising. Can you tell us what functional exercise is and why it's so important?
Absolutely. And if you don't mind, I'll do a demonstration as well. I'm such a visual person where I feel like it's helpful to see what we're talking about. So, Functional exercise is very different from regular or traditional exercise. And the reason for that is because regular traditional exercise tends to focus on improving generalized strength or overall strength and overall balance. Whereas functional exercise, there's a movement goal behind it. So, for example, if you have a goal of improving your walking, you wouldn't just want to generally strengthen your legs. You want to strengthen your legs in a functional way, meaning break down the components of walking. What movements are required in order to even take a single step forward? Those movements are now your exercises. And the reason that this type of exercise is so important, especially with MS, is because research shows that when you have MS, there's less carryover, meaning you could get full strength on, let's just say, like a recumbent bicycle, but you go to stand up and use that strength, and that strength is non existent. It didn't carry over from the bike to walking. But when you do functional exercise, it does carry over. So I'm going to demonstrate what that would look like for walking. So, if you have any type of limitations in walking, maybe it's balance related, or you have drought foot, or it's just hard for whatever reason, this is what you want to be keeping in mind. In order to take a single step forward, for me to bring this leg forward, what needs to happen is I first need to shift my weight forward. Then I need to bend my knee, then lift my ankle, then bring my knee up, straighten my knee, put my heel down, and all while that was happening, I was standing on one leg. So that's 7 different movements. Now, with that information, we want to put those 7 movements as exercises. So the first one was shifting our weight forward. So we would just shift our weight forward and back. And you can use mobility aids for this, but you shift forward and back. That's an exercise. It's a functional exercise that will directly translate to improving this component of walking and this component of climbing stairs. Anytime in life that we have to shift our weight forward, it will be easier because of this exercise. The next thing we said was bending our knee. So we practice bending our knee as an exercise. If it's too challenging in this position, if you're watching me and you're like, I would never be able to do that, then you can practice bending your knee sitting down, which might look something like this. You could practice it lying on your side or lying on your stomach. Change the position that you're in so that it does feel easier, eventually working your way up to a standing position. Another one was marching, bringing your knee up. So you do it as an exercise. So you break down your goal, in this case, walking, but it applies to climbing stairs, standing up from a chair, any movement, getting dressed, and you do those as exercises. You don't have to do all of them, but maybe pick two, three, four, and start there.
Excellent. Thank you so much. I'm going to bring up her book again because in her book, she gives these steps and breaks it down for us. I'm going to bring up. So she has illustrated the book and told us exactly how to do the functional exercises. And it really is a great resource. I will put a link to it in the description below. So let's get on to the weighty part of it. I am postmenopausal now, and the pounds are starting to creep up, and a lot of my viewers are struggling with weight gain or losing weight. We're living with MS, and due to a lot of factors, it is really difficult for us to exercise and lose weight. Do you have any tips on the best exercises when we're overweight and which ones can help us to lose weight?
Absolutely. And there actually is newer research that supports what I'm about to share with you. But it first does start with changing our ideas and our mindset around what exercise means. Because for some of us, we think exercise means going for a walk. And if we physically can't go for a walk, then you might be telling yourself the story that, well, I can't lose weight because I can't exercise, because I can't go for a walk. But there's so much else that counts as exercise. Even getting in the shower counts as exercise. Going to get your mail counts as exercise. Standing up from the toilet counts as exercise. So, a component of this is realizing that, because if you're able to understand that, you'll be able to see how much more movement you are actually doing throughout the day that you might not have been counting as exercise. And when you do that and you notice, okay, I went to the bathroom 5 times today, that's 5 times I stood up. It can feel motivating and like you're on the right track. So that's, I would say, step number one. Step number two is finding what you can do. So, according to research, there's two main types of exercises when it comes to MS. The first is functional, which we just reviewed. The second is more for weight loss and or maintenance of just general activity. And what is recommended for weight loss is a total of 40 minutes of exercise. Now, that might sound like a lot, but keep in mind that the 40 minutes of exercise or of movement could take you an hour or an hour and a half, because you can add rest breaks in there. It's not like it has to be start and stop 40 minutes straight, but also high repetitions. So, these might be exercises where you are holding on to very light weights. So maybe you're doing bicep curls, but the goal is higher repetitions. Instead of carrying a heavier weight and you're just doing 10, see if you can find a lower weight and do 20. Or if you're going for a walk, maybe you would want to go for a longer walk to get more repetitions of moving your legs. Or you could play around with adding speed into the equation. So, can you move a little bit faster? That's going to get your heart rate up and may also lead to weight loss a little bit quicker than if you keep your heart rate down and low the whole time that you're exercising.
I love that you talk about every little thing that we do. One of the things that I do, I have a Fitbit, and a lot of us have watches and devices that help us. I have it set to vibrate at 10 minutes to the hour every hour, and I do exercise breaks. And I get up and move every time I feel it. So that means that I get up and I let the dog out and I play frisbee with him, or I get up and I do 250 to 500 steps, and it really adds up. If I have a 10-hour day and I'm doing 500 steps every hour, that's a lot of steps at the end of the day. And I love that you're talking about doing the reps. Well, when we do more reps, we build more muscle, and when we have more muscle, we are more efficient at burning calories, so we can lose weight easier. So those were excellent tips. Thank you so much. Any other thoughts that you would like to share on either functional exercise or exercising to lose or maintain weight?
I think what I would share is you can do both. So often, when people hear what we just discussed, and there's these two types of exercise, they're like, well, what should I do? Like, should I mostly do this one or this one? And it is possible to integrate them. The beautiful thing, as we were discussing about functional exercise that we discussed earlier, is you can very easily integrate those specific movements throughout your day. So, I was mentioning the knee bending. Right now, you're probably sitting down. You could bend your knee a few times, 3 times, try to bend it right now. And then later on, if you're having a meal or a snack, bend your knee a few more times. So, exercising throughout the day like that is just as effective as exercising all at once. MS research shows that. So, especially if you are using functional exercise in that way, you can use your exercise time. Like if you've got 20 minutes to exercise, that's where you could have this second part of exercise in. So that's where you could be aiming for higher repetitions. And maybe at a second point throughout the day, you do another 20 minutes. And again, you're aiming for higher repetitions so that cumulatively you've got your 40 minutes. You also could just separate it. So maybe Monday, Wednesday, Friday, your focus is functional exercise. Tuesday, Thursday, or Tuesday, Thursday, Saturday could be your weight loss regimen. For the weight loss portion that we've been talking about, research shows that doing that anywhere from 2, some research says 2 to 3 times per week, others says 2 to 5 times. So, it's gonna be different for each person. What I've gathered from that is aim for at least twice. That leaves plenty of room for functional exercise as well.
Awesome. One last question before we wrap up. When it comes to getting our heart rates up, you talked about, people might not have the mobility to do a lot of the exercises. Any tips to get our heart rates up if we have mobility issues?
Yes, I'm so glad you asked this question. So, 9.9 times out of 10, when I am working with my clients and patients to get their heart rates up, we do upper body movements because I like to preserve our legs for leg strengthening and balance training. And if you just did cardio or aerobic exercise using your legs, more likely than not, you won't have as much oomph to do those leg strengthening or balance exercises. So I like to use our upper body, and it's often a combination of exercises of just sitting up tall and punching forward. With this, the goal is to increase our heart rate. So maybe going a little faster than what feels normal for you, or adding a little more motion, really twist and punch, or adding more power. Pretend there's a punching bag in front of you and really try to punch. So that's one exercise. We'll take a small break and then very quickly go into maybe like an arm swing exercise. And same idea, maybe go a little bit quicker than what feels normal to you. If this is really easy, you could hold on to maybe a 1 pound weight in both hands. Another example might be our upper body jumping jacks. Go all the way up or just a little. You can do flutters down here, rolling punching bag. The ideas are endless. Just move, move, move. And moving at that quicker pace can get your heart rate up, whether or not you're holding on to a very light weight or not.
Yeah, even just doing the couple minutes that we did, I'm like, "Oh, I can feel like my heart rate's going up a little bit." Oh, that's awesome. Thank you so much. All right. Thank you so much for joining me again, Dr. Gretchen. Again, always a pleasure having you. I will put links below, everybody, to her website, her YouTube channel, her program, The Missing Link. Dr. Gretchen, tell us a little bit about The Missing Link.
Yes, so thank you so much for having me back. The Missing Link is my online space where I provide physical therapy based guidance for people with MS looking to improve mobility, improve walking, make your daily activities feel easier through research backed exercises. So there's several different exercise calendars telling you exactly what exercises to do each day, and each exercise has its own video demonstrating exactly what to do, so you'll never feel lost. We have lots of opportunities for you to get your questions answered during our live exercise classes. We have 7 live classes every month that are also recorded, so if you can't make those live, you can watch the recordings, and that also includes, an 8th live video, which is a guest speaker who's an expert in the MS community, maybe an MS neurologist, a registered dietitian, an acupuncturist, educating us on their area of expertise. And then we also have the community component as well, where you can share your wins, your struggles, products that you found to be helpful. And having that community approach adds that layer of accountability as well, which has been really empowering for a lot of my members.
Oh, I love that, having a program that includes a live component, a community-based component, and accountability. That's really awesome. I will also make sure to include a link to the Missing Link book that you can purchase. If you'd like to see more with Dr. Gretchen and I, watch these videos next. And until next time, be well.